My name's Emery. I'm a nurse that works here at Pender Clinic. I have been asked to talk about some team-based care that we're doing at the clinic here. So I'm a nurse, and another nurse, her name is Emily, worked with a doctor named Dr. Merkley, and we trialed team-based care here at Pender. And I just want to speak a little bit about why team-based care is awesome. Prior to the pilot, the way our clinic works was it's a lot of task-based kind of nursing care, so blood work, wound care, STI testing, but all very task-based and very much the client comes in, the nurse does that, and they leave. Whereas with team-based care, what we do is we usually huddle in the morning, we talk about the clients coming in for the day, and provide a more, I guess, well-rounded and more thorough care for the clients that come in. We also have a social worker that comes and chats about the clients in the morning. And yeah, so with these meetings that we have, we also call it warm handover. We're able to discuss what's going on with the clients, get to know the smaller group of clients who the Dr. Kim Merkley has been working with for several years. And in bringing up, I guess, the client that's coming in for, their cardiac medication, we can also discuss, if they have housing issues or if they haven't had wound care done in a long time. So everyone in the interdisciplinary team is aware of what the client needs, and then in that day, everyone is hopefully able to touch base with the client. So yeah, team-based care is great. Thanks for listening to me. Bye.
Hi, my name is Terry Dean. I am a social worker too on an ICT team at the Pender Community Health Clinic. And I just want to tell you my experience of being here and starting this team-based care. So about 2 years ago, we had a change in the downtown east side where we got onto these integrated care teams. And so, we're trying to figure out what that looks like. And, there were a lot of changes, new people coming and going all the time. So it wasn't really gelling. And I think this team-based care now is more of what I think the model is supposed to be. We meet as a team, and there's social workers, nurses, doctors, and we get together and we talk about the clients that are coming in. So what's been happening is a doctor will see their clients for the day, and then we'll all meet and we'll say, oh, can you see this person or that person? If it's a new person, we all try to meet the person and introduce ourselves so they know what we do. The premise is so that we're wrapped around the client, so the client can see all of us hopefully in one visit. So they might come in, they might it might be a methadone intake or whatever, and they'll ask me to come and speak with the client. I'll introduce them, tell them what groups we have or whatever, what social work does at the clinic here. And so that is it. When we have our team together, we're more it's more share care. So the client feels supported by not just one person, but by all of us in all different disciplines. It's been really, I've really enjoyed it. I mean, I've been here at the clinic a long time and we've all worked well together, but I think this is more about what a vision for good client care is to have like a one-stop shop where they get to get all their needs met. I mean, we're really fortunate. We have all these disciplines here at the clinic now. There's psychiatrists, there's internists. So this client really is going to be able to just come to the clinic and be supported in all these different areas. As a team member, I think for me it's been very helpful because I feel more support within the clinic. So we get busy and we get busy doing things and that, and then sometimes you would see people and you could have a bad day, but you're kind of dealing with things, and yes, I can go to my other social worker that I work with, which is great, but when we're doing team-based care, they're right there, so I can go to the team and say, this just happened, or did you have trouble with this client, and like, let's think about this. And I don't know, I just feel more supported that way. And it's been more fulfilling for me, like job satisfaction for sure. And I think it's definitely helping the client too, because they feel more supported. I mean, I'm getting really positive feedback from the clients, like, oh, this is a great place. Like, I just saw the doctor and the nurse, and now I'm seeing you. And like, I don't know, I think that's the vision that BCH wants to have. So, yeah, I mean, I think it's the way to go, and I'm really happy that I am on a team, and I get to know my colleagues really well. We have it just feels better to be at the clinic and do this hard work that we all do together, not in isolation. And I think that's good for all of the teams. We all find out exactly what we do too. I learn more about what the nurses do. They learn more about what we do as social workers do. So yeah, I'm really happy with the team-based care, and I hope that it starts to become like the normal. So yeah, thank you.
Hello, my name is Kim Merkley. I'm a family physician here at Pender Community Health Center, and Miriam has asked me to speak to you about team-based care. Team-based care is something that I fully believe in, and it took me a little while to get to that point. So I was fortunate to participate in a project, and by doing so I had to do some reading and gain a better understanding of what team-based care is. There's a lot of information out there nowadays, and I pulled 6 key concepts that help me understand what team-based care is. The first concept is interdisciplinary. So you want to make sure that you've got a nice blend of different disciplines under one roof that can provide wraparound care for your patients. The second key concept is that it's person-focused. So this is related to a patient-centered approach to care, and it expands in 2 ways. It tries to pull away from the disease focus and look at a lifetime experience of someone's health. And I also like using the term person because we can extend that to our staff and colleagues as well. So as medical providers, our number one concern is our patient's health. And we also need to consider the health of all of the people that we're working with on a day-to-day basis. And I think person-focused helps us encompass all of that. The third key concept is that team-based care is relationship-based. You really need to invest in building trusting relationships, not only with your patients, but also with everyone that you're working with on a day-to-day basis. And that takes time and energy, and that needs to be really thought out when you're pursuing a team-based approach to primary care or medical care in general. The other component that comes up is redistribution of work. So what you want to try to do is spread the work out amongst the team so that you can learn to be as efficient as possible, and ideally people are doing what only they can do, and that way again you're able to increase access and increase efficiency to provide improved quality of care for your patients. One of the ways that you can increase that efficiency is to plan in advance. So pre-visit planning is a really important component of team-based care as well. That is going to vary from team to team on what exactly that looks like. For example, we learned from another team that was planning their visits a week in advance. That's not possible with the population that I work with. So we actually plan once and sometimes twice a day when needed. But it doesn't need to take very long. You can have a 5 or 10 minute talk with your team members prior to that half day. And it really sets the stage for a successful, again, efficient but high quality approach for your patients. And then finally, care coordination. So as we all know, in medicine nowadays, there's even more behind the scenes work that's happening. And what we want to do is provide a high functioning team that can divide up all of that behind the scenes work to get it done for the patient. And so this is brought together under the term of care coordination. And one way to try and be efficient in terms of approaching that and get it all done so that when the patient arrives for their visit, everything is organized and they're ready to go. So that talks a little bit about what team-based care is. You'll hear from some of my colleagues that experience team-based care with me, and it's also just a really fun way to work. You really do create important relationships with your colleagues, and you can see the benefits for your patients when everyone has that healthy, trusting relationship, and it makes work more fun. And if we're happy and having fun, then we're able to be our best and provide the best care possible. So I hope you enjoy learning about team-based care, and if you have any questions, come find us at Pender.